Have you ever felt tired for no obvious reasons? Maybe your body aches even though you haven't exercised. Perhaps you catch colds more often than people around you, or your mood seems lower than it used to be. If any of this sounds familiar, your body may be trying to tell you something. Welcome back to Body Signals with Helen, where we learn how to understand the warning signs our body sends before small problems become bigger ones. Today, we are talking about one of the most common nutrient deficiencies in the world, vitamin D deficiency. Many people think vitamin D only helps keep our bones strong, but that's just one part of the story. Vitamin D plays a role in the immune system, muscles, brain, heart, mood, and many other functions. The surprising part is that millions of people are deficient without even realizing it. The symptoms usually develop gradually, making it easy to blame them on stress, aging, or simply being busy. In today's video, I will share 10 signs that may suggest your body isn't getting enough vitamin D, what causes the deficiency, foods that contain vitamin D, and what you can do about it. Remember, these signs don't automatically mean you have vitamin D deficiency. Many other health conditions can cause similar symptoms. The only way to find for sure is through proper medical evaluation and, if needed, a blood test. Remember, this video is for educational purposes only. Please consult a healthcare professional for medical advice. With that being said, let's dive in. Number 1, you are always tired. Everyone feels tired occasionally, but if you are getting enough sleep and still feel exhausted every day, vitamin D deficiency could be one possible reason. Researchers have found that low vitamin D levels are associated with fatigue in some people. You may wake up feeling like you barely slept. Simple daily tasks suddenly require much more effort. Walking up the stairs leaves you unusually drained. Even concentrating at work becomes difficult because your energy feels so low. If you have ruled out obvious causes like lack of sleep, stress, or illness, it is worth discussing persistent fatigue with your healthcare provider. Number 2, your bones or back often hurts. Vitamin D helps your body absorb calcium. Without enough vitamin D, your bones don't receive the support they need. Over time, this may lead to lower back pain, hip pain, leg pain, rib pain, general bone discomfort. Some people describe it as a deep aching sensation rather than sharp pain. Unfortunately, many people simply take painkillers without investigating why the pain keeps returning. Persistent bone pain deserves medical attention. Number 3, you fall sick frequently. Do you feel like you are always recovering from one infection only to catch another one? Vitamin D plays an important role in supporting your immune system. Low levels may reduce your body's ability to fight certain infections effectively. If you are constantly dealing with colds, flu, sore throat, respiratory infections, your immune system may not be functioning at its best. Of course, many factors influence immunity, including sleep, stress, nutrition, and chronic illness, but vitamin D is one piece of the puzzle. Number 4, your muscles feel weak. Muscles need vitamin D to function properly. Low levels can contribute to muscle weakness or reduce physical performances. You might notice difficulty climbing stairs, trouble lifting heavy objects, legs feeling weak, poor balance, feeling shaky after minimal activities. Older adults are particularly affected because muscle weakness can increase the risk of falls. Number 5, your mood has changed. Have you noticed you are feeling down more often? Some research suggests that low vitamin D levels may be associated with low mood in some people. Although mood changes can have many different causes, you may feel less motivated, more irritated, less interested in activities that you normally enjoy, emotionally drained. It is important to remember that persistent depression or anxiety deserves professional evaluation and shouldn't be blamed solely on vitamin D deficiency. Number 6, your wounds take longer to heal. Have you noticed that cuts or scratches seem to take forever to heal? Vitamin D plays a role in the body's healing process. When levels are low, healing may be slower in some people. Although many factors affect wound healing, including diabetes, circulation, and infection. Slow healing is another possible clue worth discussing with a healthcare provider. Number 7, you lose more hair than usual. Hair loss can happen for many reasons: hormonal changes, genetics, stress, iron deficiency, and even thyroid problems. Some studies have also found an association between low vitamin D levels and certain types of hair loss. If you are noticing excessive hair shedding along with several other symptoms on this list, it may be worth getting evaluated rather than assuming it is just a cosmetic issue. Number 8, you sweat excessively, especially on your head. This one surprises a lot of people. One of the classic signs sometimes associated with vitamin D deficiency, particularly in infants but also reported in adults, is excessive sweating around the head. Of course, sweating can also result from heat, exercise, medications, or other medical conditions. But if you sweat unusually without a clear explanation, it's worth mentioning during a medical checkup. Number 9, you have bone fractures more easily. Healthy bones require several nutrients working together, including calcium, phosphorus, and vitamin D. Without enough vitamin D, bones can become weaker over time. This increases the risk of fracture. Preventing deficiency is an important part of maintaining long-term bone health. Number 10, you experience brain fog. Many people with low vitamin D describe feeling mentally sluggish. You may find yourself forgetting things, losing focus, struggling to concentrate, feeling mentally slow than usual. Again, brain fog has many possible causes, including poor sleep, stress, thyroid disorders, and other nutrient deficiencies. But vitamin D deficiency is another possibility that healthcare professionals may consider. Now you may ask, how do people become deficient? Several factors can increase the risk of vitamin D deficiency. This includes spending very little time outdoors, regular use of sunscreen when outdoors, which is still very important for your skin protection, living in areas with limited sunlight, aging, darker skin, which naturally produces vitamin D more slower from sunlight, certain digestive disorders that reduce nutrient absorption, obesity, kidney or liver disease. Here are foods that contain vitamin D. Although supplement is an important source, some foods also provide vitamin D. This includes fatty fish like salmon, sardines, tuna, and mackerel, egg yolks, liver, fortified milk, fortified cereals, fortified plant-based milks, some mushrooms exposed to ultraviolet light for some people. A healthcare provider may recommend supplements if dietary intake and sunlight aren't enough. When should you see a doctor? You should speak with a healthcare professional if fatigue persists for several weeks, bone pain continues, muscle weakness worsens, you experience repeated fractures. A simple blood test can help determine whether your vitamin D levels are low and whatever treatment is appropriate. Avoid taking high dose of vitamin D supplements without medical advice because excessive amounts can also be harmful. Your body is incredibly intelligent. Long before serious problems develop, it often sends subtle warning signals. Persistent tiredness, muscle weakness, bone pain, frequent infection, mood changes, slow wound healing, unusual hair loss, excessive sweating, fractures, and brain fog may all be clues that deserve attention. They don't automatically mean you are deficient in vitamin D, but there are signs worth discussing with a healthcare professional, especially if several occur together. Don't ignore what your body is trying to tell you. Thank you so much for watching Body Signals with Helen. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and share with someone who might benefit from learning these signs. Remember, understanding your body today can help you protect your health tomorrow. I'll see you in the next video where we will discuss 7 signs you lack magnesium. Bye bye. Be well until then.